It is the first day of the rest of my life.
At 90, Norma O'Connor is dreaming of what's next after getting her COVID-19 vaccine.
I am thrilled. I'm smiling from ear to ear, but you can't see it. I'm very relieved.
Today, news for those still waiting.
Your turn is coming. Millions of doses are on the way.
A fourth vaccine, Johnson & Johnson, was approved by Health Canada for adults 18 and older.
I would not hesitate to roll up my sleeve and get any of the vaccines that we have authorized by Health Canada.
The Johnson & Johnson vaccine is the only one that requires just one dose.
This vaccine, a single shot of this vaccine, provided 85% protection against severe disease and 100% protection against hospitalization and death. So for those outcomes, the efficacy was outstanding.
It's also easier to distribute because it can be stored in regular refrigerator temperatures. Canada has secured 10 million doses. Deliveries will start in the second quarter, and all the doses should be here by the end of September. It's also not clear where the vaccines will be coming from, a facility in the US or one in Europe. The government also announced that Pfizer will move up the delivery date for some shipments of its vaccine.
With these accelerated Pfizer deliveries, we'll now be getting 8 million doses by the end of March.
An additional 1.5 million doses will now arrive in March, and an extra 1 million in each of the following 2 months.
In all, Canada is on track to receive at least 36.5 million doses of vaccines by the end of June,
accelerating Canada's vaccine rollout that has so far lagged behind dozens of other countries. Now, with increased supply, that could mean there are enough doses to give every adult a shot by Canada Day.
With more on this fourth vaccine approved, we're joined by infectious disease specialist Dr. Alex Wong, who's in Regina. And Dr. Wong, from a doctor's perspective, what's your view of the Johnson & Johnson vaccine?
Thanks, Ian. It's really exciting. There's a few things. The main thing is one dose. One dose takes away a lot of the logistics, a lot of the operational pieces required to actually get a second dose into people. It allows you to do things much quicker. It allows your people to just kind of focus on getting things done, and you don't need to bring people back either. So there's a lot of practical, operational, logistical advantages of having that one-dose vaccine, and then has been mentioned the fact that it's much more easily stored and at 2 to 8 degrees, allows you to basically just put it in a fridge and it stays stable. So you can put it in any setting you want, community pharmacy, mass vaccination sites, rural remotes, for example. So it's going to be a great option once it becomes available here in Canada. It doesn't look like it's going to be here for a month or so, though.
We have only about 20 seconds, but quickly, I'm wondering, are you facing much hesitancy from the patients you see in terms of getting a vaccine?
Not at all. Here in Saskatchewan, everyone is super excited to get vaccine. Supply, is tight right now, and demand is high. So we're really excited and doing a great job rolling vaccine out so far. We just need more of it.
All right, Dr. Wong, we'll hear more from you and a colleague later in the show. Thanks.
Thanks, Ian.